Inside the Village.
Just looking at some of the numbers and the question, the trust in news and social media, Facebook and Twitter, or X as it goes by now, towards the bottom. And of course, Mark Zuckerberg just announcing in the last week or so that now Facebook is just getting out of the fact-checking business. So it's going to be even more of a cesspool.
Yeah, that was something that was disappointing for everyone working in this space. You know, we know that misinformation is doing very well out there. And so the small checks and balances that exist and seeing those disappear is something really discouraging because we're seeing these harms. The survey showed us that 23% of Canadians have experienced a harm because they followed advice they saw online. And that's just the 23% who either recognized it or were willing to admit that they had that harm. So this is happening. And even in my own practice, I was recently doing a shift at a women's hospital, and there was a patient there who had a really bad bleed after having a baby. And postpartum hemorrhage is what it's called. That's the #1 cause of maternal death in the world. So this is a really serious condition, and she needed a transfusion to replace that blood. But she declined the transfusion because she didn't want to receive vaccinated blood. So because of misinformation, this was someone who's trying to make the best decision for herself, for her family, for her new baby. And because of this misinformation, it became a life or death situation for her. And every physician has stories like this. We want to be there to provide good information to people, but when they're being overwhelmed online by misinformation, it can be so challenging for people to navigate through.
That's a heartbreaking story just to hear that.
It really is, and I wish it wasn't a true story.
Yeah, I believe it 100%. I guess there's political figures in the world who are pushing that misinformation too, right? We live in a world where people like Dr. Fauci in the United States are seen as someone that we shouldn't be believing. And it points to even the fact the data that you guys have found here, even the fact that, to me, it's surprising that only 80% of people trust their physicians. But that means 20% of people don't. Does that seem off to you? I mean, you'd think it'd be 99% of people would trust their doctors.
I don't think that we can find 99% of people who trust any one group. So we were really encouraged to see that physicians were still the most trusted health professionals out there. And we've even seen there's a global trustworthy index, and physicians are still globally the most trusted profession worldwide. So there's a lot to be said for that important trusted relationship, especially when you can have it over a long period of time and you get to know them and they have your health knowledge and your best interest at heart. So it's really important that we work, while we're talking about this information, we also need to be working on the healthcare system, because access to care is a big part of this whole problem. And when you don't have that trusted relationship, that's probably where some of those 20% of people fit in, is that they don't even have a relationship with a physician. So how do you have a trusted relationship when you can't access them at all?
That's a great point. We're going to get into that for sure. I just want to go back to that story again that you just told. How is a doctor, or any doctor, how do they approach that situation? Do you actually try to sit a patient down when they come up with something like that, where I don't want vaccinated blood from a transfusion? How do you even begin to have a conversation? What do you try to tell a patient in that situation?
Those are really difficult situations because you know that this person is trying to make good health decisions. Nobody's trying to hurt themselves. Nobody's trying to make some decision that's going to harm their family. And that's where it's really important to start, that we have a mutual interest in this person's health outcome. We're both trying to have a good outcome for this individual. And that's where we always try to say, you know, we right now disagree on how we get there, but I am here because I care about your health outcomes. And so a lot of times what we find in those conversations is you don't necessarily convince somebody that day, but the trusted relationship and the fact that they come back is where you can build that over time. Now, in that moment, it was life or death. It was right at that moment. You have to have that conversation right then. But even more important is having somebody who could have been having those conversations over the years leading up to the birth of that baby, so that when she was there, when she was having her baby, and having that conversation with someone she trusts, you're more likely to be able to help somebody navigate through a difficult situation. We've actually studied it and found that when it comes to relationships with patients and having them follow the health advice they get from their doctor, that empathy is more important than expertise. Of course you need expertise. There's no question. But if someone doesn't think that you care about them, if someone doesn't feel like you're listening to them, if you make them feel stupid, they are not going to listen to what you have to say, because that's going to cause them to be very defensive right away. That's a natural tendency, if someone makes you feel stupid, to push back. So we're trying really hard to train our future doctors about the importance of these conversations, of meeting people where they're at and just trying to help guide them through.